And a good Friday morning. The South Shore's Morning News continues. I'm Rob Hackala. Thank you so much for being with us. Well, as promised, we have some special guests in studio. Early with us from the Coleman Institute, Dr. Brian O'Connor is the medical director physician at the Coleman Institute for Addiction Medicine in Wellesley. He is here this morning along with Amanda Pitts. She is the executive director of the Coleman Institute for Addiction Medicine and is a licensed alcohol drug counselor. And so we're going to take this time to tell you more about the Coleman Institute. The Coleman Institute for Addiction Medicine is one of the most effective outpatient medical detox treatment centers in the country. Since 1998, they have helped thousands of people free themselves from addiction to opioid pain medications, heroin, Suboxone, Methadone, and alcohol with their outpatient detox method. Well, Dr. O'Connor and Amanda Pitts, first of all, I want to say good morning to you and welcome. Thanks for being with us early.
Good morning.
Good morning. All right, so Dr. O'Connor, we'll start with you, Dr. Brian O'Connor. Tell us a bit about yourself.
Well, I trained as an OBGYN and had a big practice up in Melrose, but in 2005, I found out that my son was addicted to heroin. It really blew the doors off of me. I didn't know what to do. I didn't know a lot about addiction, but I knew I needed to learn about it in order to help him. So I went back and retrained in addiction medicine and eventually started taking care of patients who were pregnant and addicted. And I did this for approximately 3 years, but as we all know, what happens when you're pregnant, you eventually deliver, and I needed to find care for them. And it was very difficult to find quality care in the neighboring towns. So I started Middlesex Recovery as a way to take care of these patients. I started that in 2010, and it grew. We have 6 offices now in eastern Massachusetts. And last year, I became the medical director of the Coleman Institute.
Wow, okay. And Amanda, talk about what makes the Coleman method so unique.
Well, Rob, unlike traditional inpatient detox treatment centers, at the Coleman Institute, our patients come into the office during the day to receive treatment, and then they return home where they feel the most safe and secure. Our program is comfortable, safe, and delivered by our specialized medical team. We have a 98% detox completion rate, and we're open 7 days a week, so we can begin treatment when it works for the individual. Our outpatient detox services can be completed in as little as 3 to 5 days, and at the completion of the detox, unlike traditional detox programs, we have 6 months of case management support and naltrexone maintenance. And for those of you that don't know what naltrexone maintenance is, it is a non-addictive opioid blocker that reduces an individual's cravings for alcohol and opiates.
Oh, wow. Okay. All right. Well, that makes a lot of sense. I mean, I imagine, blocking that would be extremely helpful. Now, Dr. O'Connor, what are the trends in addiction treatment currently? Do we use a lot of the similar methods that we used for years? Are there new? It sounds like there have been some developments over the years as well.
Well, there have been developments, but probably the most important thing was the pandemic itself and how it changed the way we live our lives.
Yeah.
It seems like the pandemic poured gas onto the fire. There was more isolation, increased stress, depression, and anxiety. This led to increased drinking at home as well as drinking in the morning and drinking alone. Many patients will say that I never drank alone, I don't think I have a problem drinking, and then all of a sudden they're stuck in their house and they're not socializing, and they end up starting to drink alone. There also was less access to support groups, a lack of in-person scheduled activities, and just a basic change in the way we socialized.
Yeah.
We used to socialize at specific times during the day. That was after work, with work colleagues, and essentially when you're working from home, you're isolated.
Yeah. Yeah. What is the typical patient experience for alcohol detox? How does that work?
Well, as Dr. O'Connor said, Rob, we are definitely seeing more individuals accessing treatment for alcohol. Because we're open 7 days a week, it allows us to be really flexible. Many of the individuals that prefer an outpatient model of treatment really want minimal disruption to their day-to-day. So our goal is to help them to get into treatment with as little disruption as possible. So, for example, if someone wanted to start treatment on a Friday, they could start treatment on a Friday and they can be completed by Sunday. So it's just really convenient for a lot of people, and we can complete it in as few as 3 days.
All right, and what insurances do you accept?
We are currently accepting Blue Cross Blue Shield, Tufts Health Plans, Beacon Health Options, Unicare, and Humana.
All right. And how would someone listening this morning get in touch to find out more about the Coleman Institute?
Well, we would love them to come visit our website, which is located at www.thecolemaninstitute.com, or they can feel free to reach us at 1-800-429-42212.
And again, that's the ColemanInstitute.com is the website. Is that correct, Amanda?
That's correct.
All right. And people can go there and they can get more information. It looks like there's a lot more information there to get started. And Dr. Brian O'Connor with us, Amanda Pitts. And Dr. O'Connor, I know, and thank you for sharing your personal story. I imagine there's so many people out there that know of relatives, people in their lives that they love that are affected by addiction. And we also may have people out there this morning that feel that they may have an issue and they would like to take care of that. The important thing is, Doctor, how do they get started, that first step to know that you need help and you want to get help? Because you need to want it, right?
Correct. You have to self-evaluate and really look at your activity. As a physician, when you're interviewing a patient, we have the double rule, which is when you ask somebody how much they drink, whatever the answer is, we double it.
Okay.
So a lot of patients aren't self-aware of their alcohol consumption, and they try and minimize it. So I think truly understanding how much you're drinking, but also, is it starting to become a problem in your life?
Yeah.
And there are certain criteria that the medical community has to determine the severity of your problem. That can easily be done by a screening tool at your primary care, a physician, and just answering honestly, how many drinks a day, how many drinks a week, have you ever had problems with socialization? Have you ever tried to cut down? Have you ever been told that your drinking is creating problems with the relationships? And relationships tend to be one of the first casualties you see when you see somebody who has a substance use disorder.
All right. Dr. Brian O'Connor, Medical Director, Physician at the Coleman Institute for Addiction Medicine in Wellesley, and Amanda Pitts, Executive Director at the Coleman Institute for Addiction Medicine, and she is a licensed alcohol drug counselor. TheColemanInstitute.com. Dr. O'Connor and Amanda, thank you both for coming in early today.
Thank you for having us.
Thank you very much.